3.
Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and we are nurse educators. You are tuning into our series In the Know, where we make it simple. Today we're sharing with you one of our favorite topics of our entire program, diabetes like you've never been taught it before.
Before we get started into our awesome diabetes story, we invite you to subscribe to our live videos. This way, whenever we do a live video online, you will be notified. You can also subscribe to us on YouTube. You're going to find a few years worth of videos there on our YouTube channel. Like and share this video with your nursing friends, as I'm sure you will find the value in mastering diabetes. And please be sure to follow us on Facebook, as well as check out our website, www.n-powermentnursing.com, where you can view all of our complete study packages there. So today we are talking about diabetes. This is one of our absolute favorite things to teach. Diabetes is a major health concern in our population. There's also a ton of not just knowledge around diabetes, but as well as safety and patient teaching. So it really is a go-to question for your registration exam because of those reasons. But how well do you really understand diabetes? I know everybody was taught the pathophysiology and treatment of diabetes, signs and symptoms of hyper and hypoglycemia throughout your nursing program, but do you know it well enough to draw a picture at the bedside? Do you know it well enough to just have immediate knowing when posed a question to diabetes? That really is how well you have to know it for success on your registration exam. So hopefully with what I'm going to draw for you in a few minutes, we're going to get you instantly there. That is our goal.
We found that teaching it creatively and interactively helps embed it into your long-term memory. We teach diabetes as a story. There are characters in that story. We teach it once to students at the beginning, and often by the end of their study process, they can recall it immediately. Mm-hmm. It works, being able to picture it as characters and a story.
How I actually came up with this story was I was helping somebody who was trying to get into a nursing program, and they just couldn't wrap their head around the memorization of kind of the feedback loop as it's put in textbooks when it comes to diabetes. And so I came up with this story to help teach somebody else, and realized, wow, I need to teach that to all of my students because it's so useful. So now we're going to switch over to the iPad, and this is the diabetes story. We hope you find the value in it. So we're going to start with the main players in our story, if you will. We call them the main players, and they are the pancreas. The pancreas is the producer. Notice the play on letters there. The liver is the locker, again with the play on letters there. So what does the pancreas produce? The pancreas produces insulin. And I want you to think of insulin as a key. Although I cannot draw, that's okay. I'm not an artist. The liver is the locker. So it holds in it glucose, stores glucose in this locker. It stores it as, conveniently, glycogen when it's in, yes, that rhymes, and it releases it as glucagon when it's gone. This will make sense as soon as I draw you this picture. So here's our main players. We have the pancreas, the producer. The pancreas produces insulin. Insulin is a key. Then we have the liver. The liver is the locker. The locker stores glucose, stores it as glycogen when it's in the liver, and releases it as glucagon when it's gone from the liver. So here's our picture to help make this sense. To help make this make sense, sorry. This is our bloodstream, and this is our cell. So we should all know that when we eat, our blood sugar rises, and that our cells need glucose for energy to stay alive. So let's say we eat a powdered donut. When we eat a powdered donut, our blood sugar, this is sugar I'm drawing here in the bloodstream, goes up, as it should, because we just ate a powdered donut. So our blood sugar rises. So what happens when our blood sugar rises is the pancreas, the producer, releases insulin keys. Insulin literally works like a key. It opens up the cell and allows these pieces of sugar, or glucose molecules as you will, to enter into the cell. So they actually leave the bloodstream and go into the cell. So then the cell gets the glucose that it needs, the cell gets happy, and the blood sugar, as you can see, will go back down to normal, and that is homeostasis. So now what happens when we have low blood sugar or hypoglycemia? Say, for example, we only have 2 or 3 molecules of glucose. So we have 3 molecules of glucose, so we have low blood sugar. In this case, the liver or the locker will take glycogen when it's in, release it as glucagon when it's gone, and actually put the glucose back into the bloodstream to get blood sugar back up to normal. So this is homeostasis. Now we have 3 types of diabetes. We have gestational, which is pregnancy related. Then we have type 2. That's about you. That is lifestyle. That's not necessarily insulin dependent, but can become so. And type 1 is no fun. And these are the insulin dependent diabetics who require insulin by needles, this is why it's no fun, on a daily basis to maintain their insulin levels. So that is the diabetes story. We have the pancreas, the producer, produces insulin. Insulin is a key. Liver, the locker, stores glucose. It releases that glucose as glucagon when it's gone. And while it's storing it, it's called glycogen when it's in.
Amazing. Amazing story, amazing characters. If you like the way that this is taught, we teach you everything you need to know for your registration exam just like this. If you are looking to gain all the content, confidence, and critical thinking and fun you need to pass your NCLEX or CPNRE exam, we have complete NCLEX, NCLEX PN, and CPNRE course packages. We guarantee you will pass or your money back. Thank you for joining us. See you next time on In the Know.
Bye for
Bye for
now.
now.